Hi, this is Josh Hirsch with the Institute for Civic Discourse and Democracy here at Kansas State University. And today I'm going to be talking with Katie and Kara. They are both graduate research assistants with the Institute. And I'm going to be talking to them about this booklet we came up with, we've been working on for the past few months. It's called Addressing Mental Health Care. And what it is, it's essentially a handbook for discussion and deliberation on mental health issues. And it allows people to discuss, an issue that's very sensitive to people who are affected by it and people who aren't affected. So I'm going to just kind of be asking them, what they went through to come up with this end product, the different steps they took, and what they learned in the process. So I hope you enjoy.
This book came about when NAMI Kansas, which is the National Alliance on Mental Illness, came to ICDD and asked us to collaborate with them to create a guide for discussing mental health issues in the wake of the Virginia Tech tragedy. The format for this book is based on the National Issues Forum model of deliberative democracy, and this particular book will be used at NAMI Kansas's annual conference that will be held in Heston, Kansas.
The first step in the construction of our discussion guide was that the Institute initiated a framing session. The framing session involved approximately 15 people representing consumers, people within the education field, physicians, hospital representatives, social services in the state of Kansas, and legal services and law enforcement. And the framing session took place on the campus of K-State in about late August. And during the framing session, two of the Institute's facilitators took notes and facilitated the discussion, and from those notes, the 4 graduate research assistants compiled 3 perspectives, which became the focus of our discussion guide. And the really wonderful part about the framing session was that the energy and emotion that came from all of the representatives in the session really fueled the graduate students to put together a discussion guide that matched the intensity, that matched all of the opinions, that encountered all of the opinions and ideas that were given in the framing session.
Again, the framework that we used is based on the National Issues Forum model of 3 perspectives for approaching the issue of mental health. In the discussion guide, the first approach is focused on the rights of the individual and privacy, as well as the individual's right to decide what treatment is best for them, and as well as the right to decide or refuse treatment. The second approach is public responsibility, and this approach focuses on the public's responsibility or right to intervene in an individual's healthcare decision, mental health care decision, when the person is either unwilling or unable to do so for themselves. While the third approach focuses on treatment over criminalization, and this approach focuses on the fact that incarceration should not be used as a substitute for treatment, and also talks about how supporters of this perspective believe that treatment is not only more cost effective, but it's also better for the welfare of the individuals and society.
Both Columbine and Virginia Tech happened while I've been in school, and since they both involve schools and violence, the topic has particularly interested me. As I sat glued to the television in the days after both of the incidents, I felt that all I heard were one-sided views about mental health care. With Columbine, it was about the media and stigmatization that these students felt. With Virginia Tech, it was about the lack of public involvement in mental health care. And so the discussion guide that the ICDD created gives voice to these competing ideas that can challenge the singular perspective advanced by the media. That the discussion guide creates a place where people can come together, where we can break stereotypes, usually advanced by the media, and where we can hopefully come to some solutions.